Hi, this is Glenn Macnow. I'm here with Dr. Alan Seftel, the Chief of Urology at Cooper University Healthcare Systems. Doc, nice to see you today, and we're going to be answering questions today about men's health and men's sexual questions. Are you ready?
I'm ready.
I got a ream of them right here. Number one, this is an interesting one. Can certain foods help or hurt your sex drive?
That's a great question.
Oysters, right?
Oysters, there you go. Most authorities feel that foods can hurt your sex drive. Not a lot of literature or data on foods helping your sex drive.
Really?
So soy, for example. Soy is a big player in this area. A lot of people.
Let me write this down.
Yeah, you write it down. Soy.
No Chinese. Okay, gotcha.
Soy drops your testosterone levels.
Really?
Yeah.
Okay.
So you have to be careful. It's okay to have some, but not overindulge.
Okay, so no foods, you always hear certain foods are an aphrodisiac, not true.
Yeah, again, the literature, at least in our field, we're very literature-driven, very data-driven. Not a lot of data supporting foods as being great aphrodisiacs.
Okay, but be careful with that soy.
Sure, and then obviously having too much soy and too often will drop your testosterone level. So that will knock your sex drive down. So just be careful.
Very good. Now this one is interesting because I thought this applied more to women than to men, but somebody asks, can doing Kegel exercises truly benefit you?
And the answer is yes, in men as well as women. It strengthens the pelvic floor. It helps the prostate musculature, the pelvic floor musculature, helps blood flow, helps control urination. So the answer is yes, it's very helpful in men. Obviously, it's hard to do. Not something that's easy to learn, but once you've learned and mastered it, you'll do very well.
Okay, I'm not going to ask you to sit here and do it, but for people who don't know exactly what that is, can you kind of describe the process?
Kegel exercises are basically squeezing the butt area, the perineal area, the part between the prostate, between the scrotum and the anus. That area, which is full of muscles, needs to be contracted to control the urination and help the blood flow. So it requires a little bit of teaching. We have a great nursing staff in our office. They'll teach the individuals how to do that, do it well. It's a little bit of time. It's not going to happen in one session. It may take 2 or 3 sessions, but usually once patients master it, they do very well, and it's very helpful. Especially also helps leakage, with urinary leakage.
All right, tighten up a little bit, always good. All right. Doctor, somebody wants to know, and I think I know the answer to this question since I was once a young man. Is it normal to wake up with an erection every morning?
Usually most young men do. Unfortunately, as we get older, and I won't let you know what older means, I'll let you just tell me what you think older means.
I'm still good, thank you.
All right,
Yes.
good to hear. But as men get older, the erections in the morning do wane a little bit. Sometimes they go away entirely, but the majority of times, once you start hitting 50 or so, the erections sort of taper off a little bit in the morning.
Now, this is a pretty serious question because this is something that you got to know the answer to if you're out there being sexually active. Can women get pregnant from pre-ejaculation fluid?
Yes, because pre-ejaculation fluid does contain some sperm, so there is the risk of getting pregnant from that type of sexual activity. So you have to be careful.
Right, okay. Can never be too careful. Here's one. Doc, I've heard that many people want to know what is the right amount to drink on a day or week. What would you recommend? Now, I'm not sure if they're talking about water or alcohol here, although the last part of this question may give it away. Obviously, during the Eagles game Monday night, I drank a lot more. So maybe he's not talking about water, but let's talk about both. Let's talk first about water. How much should a person be drinking? I've always heard 8 glasses a day. Is that right?
8 glasses a day is a lot, but I think if you have a history of, for example, of kidney stones or anything in the urinary system you want to flush out, 8 glasses a day would be realistic. I think for most of us, 3, 4 glasses a day of water is very doable and very reasonable.
All right,
so I have no problem with that.
Okay, so let's go to the next part of that, which would be alcohol. How much? The question is, what is the right amount to drink on a day? I'm not sure there's that answer, but maybe there's a question of what's too much to drink on a day.
Well, I think if you have 1 glass of wine at dinner, that's fine. Having more than that gets a little bit into a gray zone, especially if you have some impairment, if you're going to do some driving afterwards, things like that. So you always want to be cautious. I would think 1 drink per night, certainly not going to do any harm. And obviously, if you're going to take one of these little pills with that evening's activities, then you don't want to overdo it on the drinking. So 1 drink, I would think, is fair game.
How does alcohol affect sexual function?
So some people think alcohol actually promotes it. It relaxes the individual, allows them to be more sexually if you will, enticed.
Yeah, it promotes your bravado.
There you go.
Hold on, since we're talking about drinking, I'm grabbing my water here.
There
Yes.
you go. But some folks think that alcohol can actually knock your sex drive down a little bit. In fact, if you have too much alcohol, it will knock your sex drive down. So again, a happy medium is always best. You want to drink a little bit just to enhance things, enhance the mood, but overdoing it is never great.
Okay. This is a rather general question, but hey, people want to know and they want to start somewhere. How is male sexual dysfunction treated? Obviously, there are many kinds of male sexual
Sure.
dysfunction. I don't know that there's one broad answer you can give, but let's give it a try.
So we have all the different areas that come under this. You could have a loss of libido, desire, in which we could treat with testosterone. You have a loss of erection, which you can treat with a variety of pills or injections or other treatments such as surgery. Ejaculation problems, if it's premature ejaculation, if a man ejaculates too rapidly, there are drugs for that. But it depends again on what the specific issue is. Sometimes you have combinations. So a man can have a loss of his sex drive, could have a lack of erection, can have a quick ejaculation, and we try to treat all of them.
All right, so if somebody, I mean, generally with this question is, I'm assuming you would advise them to call.
Yeah, I think it's always
Make an
worth a
appointment.
discussion, and obviously another point that hasn't been raised is the relationship. If you're having a bad relationship, then all the pills and all the things we're going to give you are not going to cure your relationship.
That's true. Nothing kills a sex drive like hatred. That'll do it every time.
Or divorce, yeah.
Or divorce, yeah. That'll do it. Can a man, someone wants to know, can a man go through menopause?
So the quick answer is yes. I think men, as they get older, lose testosterone levels, lose a little bit of their libido, their sex drive, a little bit of their edge. They get, like you and I, a little bit of the belly fat.
What do you mean you and I?
Mostly
What?
me, less you. But a little bit of belly fat. They lose a little bit of their muscle tone, a little bit of their energy and their stamina, fall asleep a little bit more. So I think that would be what most people would consider to be male menopause. It's not the true menopause that women have, because that's a clearly defined phenomenon.
Right.
Women stop having their periods, no longer can have children. Men, it's a little more subtle, but it does happen.
So you're talking about fatigue. You're talking about some mood changes, mental
Fatigue,
changes.
mood changes, energy levels. You don't have as much get up and go. You can't do as much as you used to do. You may take a little more time doing things. You may be a little more sluggish in doing things. All things like that accompany men as they get older.
And this can contribute to your sexual attitude.
Absolutely.
Yeah, okay.
Absolutely.
All right. We talked about foods earlier, and I guess this question kind of is along the same lines, because you talked about soy being something that'll kill or retard the sexual interest. Someone says, I've read that certain foods can increase your sperm count. Is that true?
Right, so foods can actually downsize your sperm count, certain pesticides, certain foods that you may eat, so you have to be careful. Some people think vitamins may enhance your sperm count. That data is a little...
Iron, no?
Iron, not really, but maybe some vitamins, coenzyme Q, things like that. Data is not great, but it does exist. But more importantly, pesticides and hormones that are in some of the meats, you have to be careful about that. So they can really knock your sperm count down.
All right, so if somebody wants to have a baby, a couple wants to procreate, is there anything the man can do for his diet that would be beneficial?
Again, look at what you're eating. If you're eating an overabundance of red meat, you may want to cut back a little bit and think about that. If you're eating a lot of vegetables, that maybe you should think about more of an organic variety than just a standard variety. Not that I'm endorsing organic vegetables, but maybe that would be a way to think about increasing sperm count.
All right, very good.
And some vitamins, healthy vitamins for sperm. There are many in the supermarket you can pick up, and you can use those as well.
All right, here's the question that's basically been taunted every 13-year-old boy. Is it healthy to masturbate, or is there a limit to how much you should be able to do safely?
Well, I think that you and I both know that it's okay to masturbate.
Speak for yourself.
But I think that in general, masturbation is fine. Again, done within a reasonable degree of daily activity. You don't want to overindulge, but certainly masturbation is a very healthy activity.
All right. Can an improper... Wow, we're getting to this again, and maybe we've answered. And listen, we appreciate all the questions, even if they get repetitive. That's okay. So I'll give this to you, and you may just say ask and answer. Can a improper diet affect your sex drive? You really have kind of...
Again, soy, and again, the other thing is that we haven't touched upon is, if you're a little bit overweight and you have a little bit of high blood pressure or a little bit of diabetes, all of those things can affect your sexual function as well. So if you are in that sort of zone where you have high blood pressure, diabetes, a little bit of high cholesterol, a little bit of overweight, a little bit of belly fat. Those are the things that really knock down your sex drive and your erections. Those things need to be addressed.
All right. How does sterility work? Is a man who is sterile unable to reproduce? I think that is the definition of
Yes,
sterile.
right, that's correct. So a man can have an ejaculate, but he has no sperm in it, so he will not be able to reproduce.
Okay. And Doc, if a man suspects that he is sterile or wonders about it, what should he do?
Well, the first thing is to get a sperm count and see if indeed that's accurate, and then he may need to do some more invasive testing to see what the cause is of the lack of sperm. If it's something that potentially can be corrected surgically, or we can pull some sperm out microscopically, and then his partner can be inseminated that way. But if his testicles are not making any sperm at all, then it's a very challenging situation.
So if there are 100 couples who find themselves infertile, they can't reproduce a baby, is it more often the issue with the man, with the woman, fairly split? How does that tend to
Usually
break down?
people think it's fairly split at this point, and obviously there are quality centers. Cooper is one of them, where you can have an evaluation and see what the true cause is of the problem. Sometimes it's combination, men and women. Sometimes it's the man, sometimes it's the women. It's hard to say, obviously, but most authorities would go 50-50.
All right, Dr. Seftel, is there anything physically I can do for stronger erections, somebody wants to know?
Well, again, the pelvic floor exercise is exercising, a little walking around the block. You don't have to go and do a Stairmaster. It's been shown that if you walk around the block, just a nice, comfortable pace will enhance your cardiovascular system and help your erections. Cutting back a little bit on some of the chips, maybe a little bit of beer, things like that, just will help a little bit.
Let's not rip the beer, okay? Big fan of beer.
Sorry, all right. Cutting back on the chips and other things may be helpful, just getting a little bit of the belly fat down. So walking, light exercise, a little bit of dietary control will all help.
Okay, so we've talked about some of the physical aspects. Somebody wants to know, is there a mental aspect to erectile dysfunction?
Of course. I mean, even though most people think men don't have to be in the mood, the reality is they have to be in the mood. And if, again, they're having a difficult time with their partner, they're having a lot of stress at work, if the Eagles are losing, things like that, that can all contribute to a negative sex drive.
All right, Dr. Seftel, thank you very much. I'm Glenn Mack. Now, this is Dr. Alan Seftel, Chief of Urology at Cooper University Health Systems, and we'll be back with more of these segments down the road.